My name's Dr. Jason Page. I'm a GP and I'm the cancer lead at Rotherham CCG. And I'm here with Dr. Vicky Athy, who is a consultant respiratory physician and the cancer lead at Rotherham Hospital. Hi, Vicky.
Good afternoon.
Hello. So what we're here to talk about today is to talk to patients about the differences between lung cancer and COVID, because what we know has happened over the past few months is that fewer people are presenting to their GPs with lung cancer. And that's possibly because people are afraid of coming to see clinicians because of COVID, but also because some of those symptoms between COVID and lung cancer are similar. So just to put things into perspective, it's the 23rd of February today. So Boris's roadmap was published last night. So we now know we're coming towards the end of COVID, hopefully, and then we're going to start to see some more movement. And I think what's going to happen, therefore, is people are going to become more confident, and perhaps those illnesses that perhaps they've not been paying attention to are going to start becoming more predominant. And I think more patients are going to start coming to see us now. So I think it's really important to try and tell the difference between COVID and lung cancer symptoms. We know that over COVID period, the number of people coming to see their GPs who have then had a referral to the hospital for potential lung cancer has gone down a lot, by about half. And many more people have been coming to the hospital as emergencies. So Vicky, could you just perhaps explain to patients why that's important and what that means generally for patients if they end up coming to hospital as an emergency rather than being referred by their GPs?
So we have very clear pathways for patients referred by GPs, and it usually means we can very promptly arrange the necessary investigations and tests in a timely manner. But as an outpatient, meaning that you aren't in hospital, there are also many tests that we aren't physically able to do when you're in hospital. And often when people do come in unwell through A&E, they're not well enough for us to do those tests at that time. So getting people to attend for an assessment with their symptoms as early as possible is really important in ensuring that they get rapidly through the investigations that they need and onto then hopefully treatment for whatever condition. And we know that the vast majority of people who present to either their GP or to hospital with symptoms that could have cancer, the vast majority of those people won't have cancer, but it's important to try and get to the bottom of those symptoms and get the treatment that you require. And clearly, if that is cancer, the sooner we can find that and treat it, the better.
And is it fair to say, Vicky, that if patients have become so unwell that they need an emergency admission because of a respiratory condition, and it turns out to be cancer, that generally that cancer tends to be worse than if they've been picked up with no symptoms or very few symptoms?
Absolutely. Often, unfortunately, we see that people presenting acutely to hospital with their symptoms tend to have more advanced cancer. And are more obviously more unwell with it. Those people who are picked up early generally have fewer symptoms from that.
And that generally means that they're more likely to have a better outcome and survive long-term their cancer than if they're picked up very late. Is that correct?
That's correct. We know that if the cancer is purely confined to the lung in this instance, we know that the chances of surviving long-term are much greater than if we pick up later on where the cancer may have spread to affect other parts of the body.
Okay, thanks, Vicky. So it sounds like then the message there is, get advice from a clinician, preferably your GP, as early as you have symptoms. So perhaps that's a good time to just move on to the different symptoms, because one of the difficulties I think patients have is that obviously we know that COVID predominantly is about having a cough, but predominantly that one of the main symptoms of lung cancer is about having a cough. So how can patients differentiate? How can they tell the difference between the cough of COVID against the cough of potential lung cancer?
So in the initial phases, the cough may be very similar. Often with COVID, it is a dry cough, so you don't cough anything up, but we know that that's not exclusive. And we also know that if you have cancer, the cough, you may not cough anything up. But I think the difficulty has been that the message has very much been for almost the last 12 months now that if you have a cough, that could be COVID, and sort of forgetting about the many other causes of cough. What I would say is if you have a cough that's come on very suddenly, then it would be important to have a COVID test, and those are now readily available. If the cough has been going on, and certainly if the cough has been going on for more than 3 weeks, then I would still seek a COVID test. But if that is negative, then I would strongly advise people to see their GP and to have a chat about whether coming up to the hospital to have an X-ray of the chest would be the next best step.
Yeah, thanks, Vicky. And so the long-term teaching for GPs has always been that a cough of more than 3 weeks, you have to consider lung cancer, and a chest X-ray has generally been the process. So in fact, really all we're saying to patients here additionally is that you need to have that COVID test done first, just to make sure that we're not allowing the COVID to be passed around the hospital and other areas, I suppose, to keep everybody safe as much as possible. And also it allows us to make that COVID diagnosis if needed.
Yes, absolutely.
So the cough is sort of one of the main areas, but what are the other symptoms that might be less well known amongst patients of lung cancer? I'm thinking maybe tiredness, weight loss, those sort of things. Tell us a bit about how patients need to keep an eye on those symptoms as well.
Yeah, so unfortunately, lung cancer often presents with very non-specific symptoms that may actually seem nothing to do with your lungs at all. So commonly people can feel very tired indeed. They may have noticed that their appetite has reduced. They may feel that just doing everyday tasks is a bit more difficult than it has been previously, and particularly weight loss. And certainly if you were to lose weight seemingly rapidly, despite eating well and eating a normal diet, then that would be of concern. And I think all of those things should prompt seeking advice. Obviously, they are very common symptoms. And again, if particularly the lack of energy is ongoing for 4 weeks or more, then that's something that I think we would want to know about in order to see whether we need to do any further tests.
And certainly I, as a GP, have special pathways that I can follow. If somebody comes to me with weight loss or loss of appetite, general fatigue, I have special pathways where I can do blood tests and organise chest X-rays as appropriate, and occasionally follow on to more comprehensive CT scans if needs be through what we call the vague symptoms pathway. So, that's something that I've been doing quite a lot of, actually more during COVID than previously, because obviously it was difficult to see patients in the same way as I was traditionally and examine them the same way. So often we did go for some tests that perhaps prior to COVID we weren't doing so much. It's been helpful to have that testing available. So I think then what we're saying here is if you have a cough, you need to have a COVID test and then approach your GP with a view to a chest X-ray. Those other sort of non-specific symptoms, weight loss, appetite loss, lack of energy, which might be non-specific, those are the sort of things that you need to have a chat with your GP about and let them take you through a pathway of what that might be. And they're probably a little bit more complicated as to how they'll proceed with that, but potentially we have to think of cancer as one of the differential diagnoses is the technical term, one of our possible causes of those illnesses.
Yes, but again, the vast majority of people with those symptoms will not go on to have something worrying as a cause for that.
Yeah, indeed. And I often say to my patients, my job is to think of the worst case scenario and hopefully rule it out for you. And that's yes. What I try and do, because there's nothing better than suspecting something very nasty and finding out it's not at all. So that's always a pleasant thing to tell patients, well, it's not something too terrible. So, okay. Just going forward then, as COVID improves, what do you think will happen regarding sort of people coming forward for lung cancer? Do you think there are going to be a sudden, as I said at the beginning of the video, do you think there is going to be a sudden number of patients coming forward, or do you think it's just guesswork? What are you expecting based on what's happened with lung cancer over the past few months?
I suspect we will see more people coming forward, and I hope we will see more people coming forward, because I am concerned that we haven't seen the number of people that we would normally expect to over the COVID period. I can understand it's a worrying time and people are maybe worried about coming to hospital and potential exposure to COVID. But I would reiterate again that I think if you have these symptoms, they are things that need looking into, and we are trying to provide our services at the hospital in as COVID safe way as we can.
And you mentioned previously a little bit about some of the COVID safe procedures that the hospital's put in place. Could you just expand on those for me for this video, please?
Yes, of course. So we are operating social distancing as would be expected. We have perspex screens up in our X-ray waiting areas. We have social distancing in all of the outpatient waiting areas. We are offering, certainly for chest X-rays, there are some appointments available in the X-ray department at less busy times. So that would be evenings and weekends. And we also now have an additional CT scanner that is actually based, it's a mobile CT scanner based outside of our Moorgate wing. So some people coming for a CT scan won't even need to come into the hospital building.
So that's really good news, and it just means that we're keeping those patients as safe as we possibly can, in a place where people, I think, are, worried about coming to still, aren't they? And do you see, do you have many people at the moment not turning up to appointments because of those concerns, or do you think people are starting to learn to live with those concerns about COVID in your outpatients clinic?
Generally, people are happy to come to clinic, and I think if you've had symptoms you're concerned about, then most people want to come and have a discussion. Where people don't want to come face to face, we are also offering alternative appointments in terms of telephone and video consultations, but we accept that they aren't suitable, or not everybody would want a consultation in that means.
Okay, super. Well, Vicky, thanks very much for your time. Thank you very much. That's Dr. Vicky Athy, who's consultant respiratory physician at Rotherham Hospital. Thanks.